Good afternoon, North Dakota, and welcome to today's 4/23/2020 press briefing. Jump right into the numbers. 32 additional positive cases of the coronavirus disease out of 741 tests, so slight increase in our testing run rate. Good news on that, again, dividing 32 into 741, 4.3%. We'd been trending above our cumulative positive rate over the last few weeks, and now we're back down to that, so that's positive that it went in that direction. But if we take a look at the net case breakdown on the next slide, we're sad to report that, again, we had one additional death. This was related to COVID-19 today. We're reporting this individual was a woman in her 80s from Cass County who had underlying health conditions. But again, regardless of age or circumstances, always difficult to lose a parent or a grandparent, and our deepest sympathies from the First Lady Catherine and I go out to all of this individual's loved ones and to everyone who's lost a loved one during this pandemic. For the those that are really keeping track of the details, we would note that there are 2 cases that were previously reported in our data that were from Cass County, were determined to be from Minnesota and have been removed. So there's a slight 2 case change for those that are, I know some people at home are really tracking the data, like you might track shots at a basketball game or something like that. It's your shot chart, but there's a little change there. But we have now passed through the 16,000 level in terms of total number of tests. On the 4.3, which was on the previous slide, that remains the 6th lowest rate in the country behind Hawaii, Alaska, Montana, West Virginia, and Wyoming, meaning it's 6th lowest, and that's a place where we want to be low, not high. Where we do want to be high, which is on tests per capita, and we remain at 9th in the nation on testing per capita. We continue working to increase our testing rates, and as you heard from our announcements yesterday from General Dorman, the work we're doing with our provider partners and with the lab here in North Dakota, we're going to continue to move that up with the goal of getting into the more than 1,000 a day. Next week, we've got a number of testing efforts planned for tomorrow, Saturday, and Sunday across the state that should help us over the weekend when we've got a drop in provider testing to make sure that our outbound testing is going to help us get a better picture of what's going on in the state. And again, I would encourage anyone that is symptomatic and feels they need a test to advocate for yourself and get a test. And again, if you are unable to get a test completed or are turned down by a provider, we'd ask you to call our North Dakota State hotline, which is open from 7 a.m. to 10 p.m. in the evening at the North Dakota Department of Health. Contact us and we'll try to help you connect with you in getting a test, because we have the testing capacity across our state. In terms of the 425 active cases, 18 hospitalized. This is good news because we had 5 discharges released from hospitalization yesterday. So we had our peak at 23 yesterday, back down into the teens. That's a good thing. And as we reported earlier, that additional death sadly takes us to 15 deaths. When we take a look at the case trends, which we look at every day, the one very positive thing about this is you'll see that the line is going down. Even with 32 new cases, it's going down primarily because we had a new record, 40 newly recovered cases. So it's one of the ways that you can help flatten your line, and you can see we've been bouncing around in the 400s there in the chart over the last 4 days. That's because we're having good solid days of recovery to go along with that, and so you'll see that's why we're net down on the top line, which is a good thing. When we take a look at the increased rates on the rolling average, you know that the increased rate of positives on a rolling 14-day. So this is different. The 4.3 we showed earlier is from the very beginning of when we began having positives in North Dakota. This is just for the last 2 weeks. We take all of the tests and all the positives in the most recent 14 days. When we take a look at that, we were really moving in the wrong direction over the last week, but from yesterday to today, we were nearly flat. It was 6.26 yesterday, 6.27 today. So having a day when we were not moving up, but we were more or less going sideways, that's a good thing versus going up. And again, we'll continue to do a lot of testing. It's too early to call this a trend, but we would be great if that were flattening out. When we take a look at active confirmed case rates by county, and we take that by number of 10,000 individuals, there's about 5.6 people per 10,000 that are currently have an active case of COVID-19. We're just talking about the actives. And this map shows where those actives are as a percentage of population. We see with the LM wind outbreak that we had in Grand Forks that moved Grand Forks from one of the lowest states up to one of the highest, slightly ahead of Dunn County. And then you can see others that were on here that were higher before, like Montreal, continuing to fall as they have more recoveries than new cases. And again, this also highlights, because people focus sometimes on the highest number of absolute cases, yes, is in Cass County, and of course we're also focused that there's over 60 cases cumulative on the Clay County side, so that metro area has the highest absolute number of cases, but in cases per population, Grand Forks right now has about twice as much as Grand Forks County, twice as much as Cass County. I think the other thing on this, when you look at your county and say, hey, we've got a low rate or we've got no positives at all, we believe that there are positives in every corner of the state. And if we had more widespread testing, we could prove that either people have it today or they did have it previously. That's why we're continuing to expand testing. And so again, we ask that every citizen in the state, wherever you are, to continue to follow our North Dakota SMART guidelines that are helping to slow the spread. And we would also remind people that, as we saw in Grand Forks, where Grand Forks was one of the lowest counties a week ago, and now it's one of the highest, we know that outbreaks can happen anywhere, not just at manufacturing facilities, but they could happen in a school, they could happen in a gym, they could happen in a bar or restaurant. And as we work hard to open up, which is our focus right now, as we work hard to open up, we have to be prepared to be able to deal with outbreaks, because the calendar turns to May does not somehow magically cause outbreaks to not happen, because the virus is still just as contagious now as it was when this pandemic began. As we take a look at our plans to reopen, just briefly, we know again that we're on a North Dakota SMART restart. The things we're going to need, widespread rapid testing. We'll have a little bit more to say about that tomorrow, in addition to our announcement yesterday. Again, protections for the most vulnerable. We announced that earlier in the week with Chris Jones talking about our VP3, the vulnerable protection plan that we're talking about, and also sufficient healthcare capacity. We continue to keep that box checked solidly in terms of the availability of healthcare. PPE, we're in good shape right now. We'll continue to monitor that, but we would think by the end of the month that can have a red check. We are talking about new standard operating procedures for businesses. That work is going well. We had a meeting last night led by our commerce team and Michelle Comer, and again, the work that we're doing now helps prepare us for the second surge. So I want to give everybody confidence that this is our primary focus every day, is working through these 8 work streams. We've got leaders identified for each of these. We're piling resources against them, and we continue to make solid progress in this direction. I want to give just a little bit of a highlight for a look ahead for tomorrow. We know that we've had a lot of questions from people since this began. What can the state do, and specifically, what can you do from the Bank of North Dakota? We're fortunate to have this institution that we've had in our state for over 100 years. It's got a great mission of helping serve the people of North Dakota. And right now, whether we've been in terms of disaster, whether it's due to previous previous energy crashes or agriculture disasters or helping families or students with home ownership or students with college education, BND has always been there. And we have held off on announcing any significant programs because we were waiting for clarity about the CARES Act. That greater clarity arrived last night, and Senator Hoeven is here to talk about that. And with that additional clarity, Lieutenant Governor Brent Sanford and Michelle Comer, Bank President Eric Hardmeyer and his whole team, everybody's been working on the North Dakota Smart Restart and the COVID Recovery Loan Program ideas. There's been a lot of those kicked around. Tomorrow, we've called for a special meeting of the Industrial Commission at 1 p.m. That'll get noticed today at 5 o'clock, and we'll have a meeting tomorrow where the Industrial Commission, which is Ag Commissioner Goring, Attorney General Stenjum, and myself, the three of us constitute the Industrial Commission, and we will be meeting with the Bank of North Dakota as part of our emergency meeting tomorrow to discuss COVID loan programs, recovery loan programs, and hopefully we'll have some more information to share. But we know there's been a lot of interest across the state, and specifically those loan programs are going to focus on businesses that were affected by our executive orders, that small segment of the North Dakota economy in percentage of the whole that was asked to close, because as you know, all of ag, all of energy, all of healthcare remained open, and all of education kept operating, albeit with distant learning. So with that, we want to move to having a discussion about the CARES Act. And as you know, this is the $2.2 trillion Coronavirus Aid, Relief, and Economic Security Act, which was passed by Congress and signed into law by President Trump on March 27th. Because there was a minimum threshold for that, North Dakota received the minimum level, which was in this size of a $2 trillion act, was $1.25 billion. That came in two tranches, both of which have been deposited at the Bank of North Dakota. Last night, we received guidance from the federal government on how the money can be spent, and we were thrilled to see that the Treasury Department has granted our specific request that we allowed to use the funding to help cover our unprecedented increase in unemployment insurance costs due to job losses from this pandemic. And of course, we're grateful to the administration and President Trump and Treasury Secretary Mnuchin, but we're especially grateful to Senator Hoeven, Senator Kramer, Congressman Armstrong, whose collective efforts made this happen. And again, know that Senator Hoeven, who's here today specifically as a former ND Bank president, former governor, he really understands exactly the needs of the states, and he's been a powerful advocate to support us here in North Dakota, and we're grateful for that and grateful to have him here to talk about the CARES Act. But before he comes up, I do want to set the stage relating to this, our unemployment figures. And again, they're kind of hard to get your head around a little bit, which is that there have been 60,404 regular unemployment claims since March 16th, just to bring that into perspective, we have paid out $105.8 million since March 16th, and half of that came from about half of that, 51.3, came from our state unemployment insurance trust fund. 54.5 of that has been paid by the federally funded pandemic unemployment compensation program, which is the one that provides an additional $600 per week to unemployment insurance to an individual. But the comparison here to help people understand what our hardworking job service team has done with those 60,000 claims, that's over 3 years worth of claims. And in terms of payments, we've paid out $105.8 million since March 16th. In 2019, we paid out only $78 million in the entire year because we had such low unemployment. The year prior, 2018, we paid out $99 million. And so we have since March 16th paid out more than either we paid out in the last 2 years. Currently, our trust fund has, Unemployment Insurance Trust Fund has a balance of $144 million. That's down by the $51.3 million that's already been paid out, so down from approximately $200 million to $144. And again, when we look ahead, we know that we could end up paying substantial benefits today, which would overwhelm that additional $144 million. And again, part of the great news that Senator Hoeven's delivering here is that we can now, for sure, with the guidance last night, use CARES Act funding to replenish that. In addition to that, there was already authority to be able to borrow from the U.S. Labor Department, but using the CARES Act funding helps make sure that unemployment claims get paid, and we don't have to increase a burden with substantially higher rates on the businesses of North Dakota. So again, I'd like to invite Senator Hoeven up to explain more about the CARES Act funding and how it's going to help not only North Dakota workers, but North Dakota businesses and North Dakota hospitals. And again, Senator Hoeven, thank you for your tireless and successful advocating for the people of North Dakota. Appreciate it.
Thanks, Scott. Thanks for your incredible leadership. And no one works harder than Governor Burgum, as you all know. He covers the bases like nobody I've ever seen. And your leadership shows in so many ways and is greatly appreciated. I am pleased to be here today. This actually is a request as far as the unemployment insurance fund that came from Governor Burgum to me. And I would have to say that your lieutenant governor is doing a heck of a job too, because there weren't many days that passed where I didn't get a text from Lieutenant Governor Brent Sanford saying, wow, there's a lot of money that is coming out of that unemployment insurance fund. And that's going to be a real challenge for our businesses, because as they get opened up again and get going after this slowdown in our economy, first thing they're going to see are these really high unemployment insurance rates or premiums, taxes, unemployment insurance taxes. And so that's exactly what we don't want, because that hurts their ability to get up and get going and to employ their people and get back on their feet. So Governor Burgum approached me and said, can you connect with Treasury? Because Treasury was not going to allow the coronavirus relief fund to be used for this purpose. They weren't going to allow those funds, of which North Dakota has now received $1.25 billion, to be put into the unemployment insurance fund to help offset this impact. So I did a couple things. One is we put together legislation thinking that maybe in the next round of legislation we could pass something, but we also went direct to Treasury. But more than that, I had calls with the President and the Secretary of the Treasury, Mark Meadows, the Chief of Staff, and also we had Secretary of Labor Scalia on a statewide call with us with the Greater North Dakota Chamber of Commerce. So we really pressed this issue, and not only with the administration, but with Leader McConnell and others, hoping that we could get Treasury to approve this rather than having to pass the legislation, because we wanted to get it sooner. And last night about, 7 o'clock, we got word, my staff got a hold of us, and we got a hold of Brian Klipfel and Governor Burgum, and we have the approval now to use these funds. So this is very important, because it again goes to helping our business and their workers through this very tough stretch with COVID-19. Now again, the state receives, this is part of the $150 billion coronavirus relief fund, of which the state receives $1.25 billion. That's our share. Now, Governor Burgum will, along with other state leaders, legislators and so forth, will make the decision as to how much of that they used for the unemployment insurance fund and how much of it they use for other purposes. So again, that is how we try to do this, but in a way that makes sure that as we utilize these funds, whether it's from the CARES Act or anything else, that we're doing it in a way that the states can use to greatest effect. And of course, there's not a one-size-fits-all. Every state's different. I happen to think that our governor's doing it better than anyone. But the demands, the needs in North Dakota are different than they are in New York or Louisiana or somewhere else. If I could touch on a couple other things briefly relative to the CARES Act. I had talked about agriculture before. I was able to include $23.5 billion in the CARES Act for agriculture, as well as authorization to include livestock in that assistance. The Department of Agriculture now, as you saw on Friday, came out with a a framework, which we've been working on, which is 9.6 billion for livestock, another 6.5 billion for crops, so 16 billion of that 23.5 billion, plus another 3 billion, so a total of 19 billion for purchases. 3 billion purchases, 6.5 billion crops, 9.6 billion for livestock. We've gathered input, including from our great ag commissioner, Doug Goring, and our producers, and we've provided that input back to USDA. As of tomorrow, they will submit a package to the Office of Management and Budget at the federal level because it requires a rule. OMB has to approve it and approve the rule, which is, in essence, specifies the delivery of that ag assistance. I'm hopeful we can push that through in less than 2 weeks. Our goal is to actually have farmers and ranchers signing up in May for the assistance and getting checks or getting that assistance starting in May. And so that's the timeline on the ag piece. On the, as you know, on the PPP, the House is voting on that now. We moved it through the Senate on Tuesday. We expect the House to have it wrapped up tonight. That will be another $310 billion for the Paycheck Protection Program. That's the $250 billion we talked about getting, plus another $60 billion for a total of 310 that flows through smaller institutions. The idea being there, smaller financial institutions, the idea being that those lenders can get out and make sure we're getting to those entrepreneurs and smaller businesses. In addition, we added $50 billion for EIDL, which is the Economic Injury Disaster Loan Program, and another $10 billion for grants, so a total of $60 billion for the Economic Injury Disaster Loan Program. That's the program that provides up to $10,000 grant on the front end and then a low interest loan. The other thing we did is we made sure that it covers farmers, and that was something that I expressly worked on to get. So now farmers qualify both for PPP but also for the Economic Injury Disaster Loan Program, for both of those programs. So that's important. Then the other piece, of course, in this CARES supplemental is another $75 billion for our hospitals. We tried to get a focus on rural hospitals, and $25 billion for testing. And of course, Governor, you've done a beautiful job of talking about the importance of testing. So another $25 billion that will come out to the states for testing. The only other piece I'll mention is for our energy industry. Obviously, more work needs to be done. I know the Industrial Commission, led by Governor Burgum, is working on the energy piece. We're also trying to make sure that we're bringing vital assistance there. For the smaller companies, the Paycheck Protection Plan. For companies that aren't able to use PPP, we're working on the Market Stabilization Program. That was funded under the CARES Act. It's called Section 13.3. And I've been doing a lot of work with Secretary of Energy Brulette and Secretary of Treasury Mnuchin to get that program in a form that works, so that for our energy companies, they can either use PPP or that 13.3 Market Stabilization Facility to get access to credit. So critically important. And the other piece is I have a bipartisan bill to purchase oil for the Strategic Petroleum Reserve. We originally had that in the CARES Act. The House did not agree to it. So now we're going back to get it. I have bipartisan support for it in the Senate, and we got it through the Senate last time. But I also now have a companion bill in the House, bipartisan. We've got 5 Democrats helping lead the charge there in the House, so we hope this time we can get that help for our energy producers as well. So again, just some updates on the CARES Act and the CARES supplemental. I think those are the main points, other than, once again, thanks for letting me join you, and thanks for your great leadership. Governor, appreciate it very much. And to all of our great North Dakotans, you're doing a fabulous job. Keep it up. Thanks.
Senator Hoeven, I know you'll stick around for questions afterwards, so thank you for that. Thanks for that update. And again, when we go through this, you think about certain people end up in certain positions at certain time, and maybe it was meant to be, but I just know as North Dakotans, we're so fortunate to have somebody in the U.S. Senate who understands business, understands banking, understands agriculture, understands energy, understands the needs of small business, understands our state. So again, thank you for advocating so hard for everyone here. Okay, other things we want to provide as updates, again, on the clarity that has come out last night that will help people around the state. I've said generically to all the local political subdivisions, and whether that's a county, a township, a city, a municipality, and even if you're like a local rural EMS that's a government entity where you've got a rural local ambulance service, I've been telling everybody all along, keep your receipts because one of the things that we did always think that in this money that the North Dakota was getting, that if you had things that were above and beyond what your budgets were before that were specifically related to COVID, that they could be reimbursed, and that's exactly the guidance we got. So again, for expenses between March 1st and December 30th of this year, if it wasn't part of your budget prior, if it was an additional expense, it may be eligible for us to be able to use state funds. And so again, whether you're, and even if you're a state agency or anybody that's working on this, we want to make sure don't wait to the future to start creating the very clear accounting about those incremental expenses, because those are all going to be reimbursable under the federal guidelines. A couple other updates relating to the unemployment insurance. We're making good progress on the computer software programming, and barring any technical issues, this relates to the aging mainframe you've heard me talk about too frequently here. But we again are hoping to pay these benefits by next week. There'll be some phasing into the payments as we need to contact some of the applicants for further information on those applications. But again, we're doing that, and I'm also happy to report that under the guidelines, we could actually replace the aging mainframe as part of critical infrastructure. So expect to see a proposal for that. Anyway, the FPUC payments are all being made weekly. Back payments have been completed. That was those 3 tranches of 20,000 payments each, going back to 60,000 weeks worth of not 60,000 people, but 60,000 weeks worth. Might have been 15,000 people times 4 weeks. But that additional, those were the separate $600 payment that was not in the software before because the program didn't exist. So now we're paying that on top of that. And then the additional $600 payment will be added to all the UI benefits going forward up until when that expires on July 30th, 2020. Wait times, that was a problem that was identified on the phone system. Callers were getting dropped while waiting to talk. We've made some changes to that phone system to address the issue. We're also we are adding additional staff and job service notes staff to the phone queues to help answer calls that come in. So again, thank you for your patience as we try to handle 3 years worth of processes in the last month. So again, the team over there working hard, and we're working hard to get them the systems to keep up. Next topic has to do with behavioral health. We have one of these every day. We know that while we're dealing with a physical issue called the coronavirus, the global pandemic, we know that behavioral health burden is increasing because behavioral health is affected by stress and anxiety. It's affected by financial distress. It could be affected by rapid changes like, hey, my childcare provider closed and I've got an aging parent that I can't see in a nursing home, or I've got kids home from school that I've got to try to help them with their homework while I'm also trying to do my job remotely. And some of you are doing all of those things at the same time, and we've got incredible empathy and respect for you as you navigate through this historic time. We're committed to continuing to support our citizens' mental health, and we want to make sure that you know that we're making decisions here based on data, and we want you to be able to have information for you and your children based on facts, not on fear. But one of the things that we know from the Kaiser Family Foundation, big national foundation, they were doing a national survey exploring the mental health issues associated with it. and they did a poll, and they were comparing those that were sheltering in place. And of course, we know that that was a big topic of states that had shelter in place. And if we pull up that slide and take a look at the quick results from that, it showed that 47% of people that were sheltering in place, almost 10 points higher than residents who were not sheltering in place. We know that we knew there was additional consequences to this. We're pleased to be among the states that has had a light touch of government and a heavy reliance on individual responsibility. And again, we want to remind people that getting outdoors, enjoying great North Dakota is something everybody can do. We encourage people to maintain physical distance from others while you're doing that. But again, getting exercise, a great way. Getting some fresh air is a great way to help manage some of that stress. We've been really careful in our response. We've talked about, we've been using a scalpel rather than a sledgehammer to make sure that we're responding appropriately and trying to limit pressure on our economy. And of course, as we said earlier, our major effort right now across the 8 work streams is how do we make sure that we get our North Dakota restart coming that would be phased and appropriate, that would allow us to get closer and back to a new normal and do that safely. If we can keep up for another second, that last slide on the disaster distress hotline, want to make sure that people know that if you look in the lower right-hand corner, but that's available 7/24, 365 days a year. If you're experiencing emotional distress related to anything, whether it's a natural disaster, a human-caused disaster, a pandemic, you can call 1-800-985-5990. You can also text Talk With Us to 66746, and you'll be connected with the trained counselor. That, of course, will be all confidential. And if you didn't catch either of those, you can go to our behavioral health .nd.gov website, and you can find out many of the resources that we've talked about over the past days. But again, take care of yourself first. As they say, put your own mask on first. That used to relate to airline oxygen masks, but I think, again, here it applies that if you're a parent wearing a dozen different hats, make sure you're taking care of yourself and don't be afraid to ask for help. Next quick update, we've been giving an update every day. If we're going to have robust contact tracing, we need to and make sure that this is one of the ways to get ourselves opened up again, is using technology that is completely confidential and private and anonymous is a way to do that. The Care19 Android app has been launched. In addition, on Apple, we've now got 23,000 people that have downloaded that. Thank you for those people that have done that, who've downloaded and enabled their location services. And again, the Google does not apparently yet have it up on the Google Play Store, but it can be directly downloaded going to a North Dakota website, belegendary.link. So belegendary.link instead of .com. So belegendary.link /Care19, and you can get it downloaded on your Android device. You can help us save lives with automated contact tracing to help us be North Dakota smart as we stop the spread and trigger our North Dakota smart restart. This I just call a public service announcement related to something that the Bank of North Dakota gets involved with every year, and that's the National Financial Bee. And that's a B with 2 E's behind it, not the letter B. That's like a spelling bee. The National Financial Bee has been going on for some time. It's for students in grades 7 to 12. It's sponsored in part by the Bank of North Dakota and a national organization called EverFi. Currently, there are 1,200 North Dakota students signed up to participate. There's still time to sign up before the contest closes on April 30th. It's got 5 15-minute modules that you can take to help advance your financial literacy, and you get to compete for scholarships. The top prize, $10,000. Again, join those 1,200 North Dakota 7 through 12 students that are already signed up. Join them and see if you can advance your financial literacy. More information can be found at the Bank of North Dakota website, bnd.nd.gov. Next topic under the good news section, which we always have every day, is this. We're in this incredible situation that few would have ever predicted that the globe might find itself in. And many of us are so focused right now on day-to-day tasks. And again, whether that's, planning safe trips to the grocery store, finding something to keep people occupied at home, caring for loved ones, getting schoolwork done. It's a very, very busy time for many people. But the State Historical Society is reminding us that it is also a historic time in North Dakota. And just as we might travel over to the Heritage Center or go view something online and say, wow, this is what was really going on in the 1930s during the Depression. Incredible what people lived through. You're going through that historic time right now. So the North Dakota Historical Society is asking North Dakotans to help document these times by donating digital stories, personal reflections, photos, home videos to be preserved for future generations, wanting to learn how individuals and families were affected by and how they creatively responded to COVID-19. For more information about how you can contribute your stories, your images, your videos, and your creative ideas about life during the pandemic, you can go to statemuseum.nd.gov/share-your-story and join others in helping to document these historic times so we can teach future generations about how our families, our work, our health, our education, our lives were affected, how we coped, and how we responded and persevered, and how we innovated during a time of disruption. So again, thank you for that. In closing, I want to share some special folks today that are doing a great job in North Dakota, because so many of you are. And the first is we want to highlight the over 5,000 North Dakotans who are living today with lifelong developmental disabilities. And these individuals need support to live as independently as possible. Some of these 5,000 North Dakotans with lifelong developmental disabilities are still going to work every day, whether that's in a grocery store or other businesses that remain open. Others may have special vulnerabilities in addition to their developmental disability, and they've had to shelter at home and learn a new way of life in response to COVID-19. In North Dakota, we've got a terrific group of direct support professionals. They work at community providers around North Dakota, and they help every day with individuals with developmental disabilities. On any given day, even without a pandemic, these direct support professionals are heroes with big hearts, and they help to protect our neighbors with disabilities from exposure to COVID-19 while supporting as normal a life and as strong a routine as possible. They provide a delicate mix of health care, work supports, and social supports to our neighbors and friends with developmental disabilities. And as they continue to provide these excellent supports through the extra challenges of the COVID-19 emergency, we want to say thank you today to all those direct support professionals for everything they do. Also, one other quick shout out. We want to give a shout out to Kathleen Wrigley. She organized a Shiloh prayer parade today outside the Capitol right before Senator Hoeven and I were taking to the podium. And again, the prayers and thoughts and kindnesses that we receive every day from people around the state are so welcomed. We know that maintaining a strong spiritual base is one of the ways that North Dakotans have always gotten through hardships in the past. We want to thank Kathleen and all those that joined in today for their effort to remind us of that importance, and also because they did it with excellent physical distancing. So way to go. Again, thank you for being with us today. We're going to be back tomorrow at 3:30. But right now we've got Senator Hoeven here, and we'll be happy to take questions. Dave? Thank you, Dave. Way to go. Dave Thompson from Prairie Public. Senator Hoeven, back to the podium. Stay as long as you want.
Dave and I graduated from high school the same year. Did you know that? He looks so young and I look so old. You can't believe it, but it's true.
I would doubt that, Senator, believe me.
And I think he's been here at the Capitol ever since. If you need any institutional memory for anything, right there.
Well, it's a repository, but messed up with some very odd facts. Anyway, there's been talk already that maybe this supplemental money for the PPP is going to run out fast. Perhaps maybe a week or 10 days or something like that. Are there plans in the works to do maybe another one?
It's been a successful program, and I think it will continue to get support. So I think what we've said all along is we passed the CARES legislation. It's $2 trillion. And that's a lot of dollars. Let's make sure we use them very, very effectively. And then where there is additional need, we address it. But let's make sure we use that funding. And so that's how we've approached the PPP Act. You know, initially the $350 billion. Now we've added. We were planning on an additional $250 billion. As I said, it's $310 billion. So we'll see. But let's make sure that we're using the money as effectively as possible, and I think that's the goal. And that's why, you know, we talked about the coronavirus relief fund. Think about that. So $1.25 billion comes into North Dakota. They have that at the Bank of North Dakota now. Well, we want to make sure that Governor Burgum and the state of North Dakota and our leadership here, and we have great leadership in North Dakota, that they can use it in a way that makes sense for North Dakota. And that's what this was all about today, talking about how we're now able to use it for the unemployment insurance fund. Same thing with all these other programs. So the short answer to your question is, yes, I would expect there would be based on the need, as long as the program is doing a good job. But to me, that's very important in terms of the approach we take, because at the end of the day, we have to remember our taxpayers and the cost of these programs as well, right?
Who then has oversight of it? Would that be Congress or Treasury or some combination of both?
Mm-hmm. Well, certainly the SBA is primary, but ultimately Treasury, and I think there'll be congressional oversight as well. And already you've seen, you know, in some cases, some bigger companies are getting this. That was not the intent. That should not be happening. And so I think we are going to work to make sure that it goes to our small businesses in line with the guidelines, and for small businesses that have that need. And I believe you will see more oversight on it, and you should. Again, let's make sure we're meeting the need and doing it in the right way.
If I may follow up, Senator. Yeah. As far as being able to judge that effectiveness, how much time does it take to determine that kind of thing?
I think you're already going to start seeing numbers coming out in terms of jobs retained and that kind of thing. And you've already seen, like I say, some of these issues about where's the money going? Is it going to the right places? Is it truly going to small businesses that need it? There's certifications that go with the application originally, and I believe there'll be additional certifications that go with the loan forgiveness at that point, which will probably be, you know, a month or so out, where again, then the small business owner would come back and certify that yes, you know, they have a loss and that they need that forgiveness. And in other cases, they may do better. They may not need the forgiveness, and so then they just end up with a low interest loan they pay back. So again, I think that'll be part of the process. Did that answer your question?
It does, but if I can go off of that, we've been getting reports that there's some hedge fund investments that have been taking advantage of the PPP as well. What kind of, I guess, what can be done to avoid that kind of thing from happening the second time around?
Right. Well, remember, part of the challenge here was getting these programs out and moving quickly and getting assistance to businesses so they'd keep their employers attached to the business and you know, not have people without a job. So part of the challenge that goes with getting the programs out quickly is you are going to have to make some adjustments. That's one that you've just identified. I think absolutely we have to look at that and again make sure that it truly is small business that's getting the funds. And then as far as the forgiveness for businesses that have had difficulty that are getting the forgiveness. So that's going to be an ongoing effort. We're already looking at it and it needs to continue.
How much of the $1.25 billion North Dakota is getting from the federal coronavirus relief fund will go towards unemployment?
Thanks, Andy. That's to be determined, and it would depend. First of all, there hasn't been any determination that that's where the dollars would go. What we're announcing last night is the dollars can go there. I mean, it was one of the big asks that we made of Senator Hoeven because early on, and he advocated it got included in the guidance last night, because when we look at 1.25 billion, and you said you can only use it for coronavirus expenses, states like North Dakota weren't going to get close to 1.25 billion of expenses. I mean, not with, field hospitals going unused and us being able to manage it with primarily with existing health care. So we've got expenses, and those expenses, I'm sure could run in the hundreds of millions, but they won't get over $1 billion. If you said, what's the biggest possible category of expense related to this? If you do scenarios where we've got high unemployment through the end of the year, we might need $500 million to replace that unemployment insurance fund. So this was an obvious big chunk of change that was not part of our budget going forward, wasn't anybody's budget plan, was all driven by COVID-19, and so very appropriate that this was included, and different states will take different approaches to this. But as I said, if we found out that we had other things that had, say, a higher possible return on investment in terms of getting North Dakota started, now we've got clear eligibility, we could use that 1.25 for that. And we do have the option to be able to borrow federally at low interest to replenish that unemployment insurance. So there is a backstop for unemployment insurance with borrowing, but if we do that, that might also increase the burden of the rates that you charge each of those businesses. So it's TBD, and again, that process will have to go through an appropriation process here in North Dakota, which will certainly include a emergency commission at a minimum. Okay, we're going to go online, and maybe we've got an online question for Senator Hoeven.
I don't.
No? Okay. Okay, well, next key. If you're online, Senator Hoeven's here.
Robin Travers with 660 KUYZ in Williston. Can asymptomatic individuals be tested as well as those showing symptoms?
The answer is yes, they can be tested, but what we're looking for right now would be people who've got a belief that they either have it because they're symptomatic, and if you're asymptomatic and you've been in close contact with people that you are known positives, then tell that to your provider and you're likely eligible to get a test. But if you are someone who's got no symptoms and has a no contact with positives, then we would likely have providers that would say to you, no, you don't need a test right now. So, but the answer is, yes, you can get tested. And of course, what we'll be talking about down the road, with much broader testing, when we talk about antibody testing, then we want to test all kinds of people who are asymptomatic to find out if they previously had it. But that's not at that stage yet, because those tests aren't available yet in North Dakota. But if you got any reason to think that you've been in contact with someone who's positive, please get tested. Lane?
Governor, an assisted living facility in Minot is reportedly suing yourself and the Department of Health over the executive order that shut down their beauty salon that was on site. Any comments on that?
Yeah, I've just been notified of that, and I don't want to have this sound too formal, but that would be an ongoing lawsuit, so we won't make any comments to that specific. I will say that we understand very empathetically that whether you're in long-term care or whether you're not in long-term care, for people, and maybe perhaps for elderly people, you've got a personal relationship with the person that's your personal care provider, getting your hair done, maybe depending on age and generational thing, that may be something that's part of perceived part of the dignity that someone has that might be living in a long-term care facility. So we're deeply empathetic, but we also understand that the rate of where we can have the highest and fastest rate of outbreak that could be fatal would be inside of long-term care facilities. So that's why we're talking about the long-term care, our VP3, the Vulnerable Protection Plan that we're working on. And then you've got an intersection of something that by definition puts people within transmissible contact for more than 15 minutes, which is what we were trying to avoid or limit with our targeted efforts to close those personal care businesses. And you intersect a transmissional moment with a vulnerable population, and that would just by anybody's evaluation be putting risk on top of risk. So we'll take a look at the lawsuit, but meanwhile we're going to try to work to both reopen personal care businesses and protect our elderly, and this is at the intersection of that difficult spot. Jacob?
Do you worry about other lawsuits coming your way over these executive orders?
I don't worry about them. I'm certain they'll come. And we'll have less than I'm sure any other state, because we closed fewer businesses than any other states, but I'm sure they'll come. When you've got a point in history that's never happened before, it tends to test existing laws, and so there'll be I'm sure a legal bonanza of lawsuits coming out the backside of this as people try to sort their way through. But for right now, we're just every day focused on serving the people in North Dakota, and some of these legal cases may or may not have legs, or they may become moot because some of them may be coming by the time we've already reopened or whatever. So I don't spend a lot of time worrying about that right now. We thoughtfully consider everything, and we do take a look at the law before we make a decision, and we feel quite confident that everything we've done so far falls well within the parameters that we have under the emergency powers. Online for Senator Hoeven? Nope, okay, I tried.
Scott Hennon with WZFG KFYR Radio. Vice President Mike Pence said today that the current trend suggests this coronavirus epidemic could largely be behind us by Memorial Day weekend. Do you agree with that statement?
Well, I certainly agree with Vice President Pence's optimism, and I would just have to say he's done a fantastic job leading the coronavirus task force. He has sometimes 2 calls a week with every governor in the nation. They stay on the line. They take every question that everybody has. He's got his team there. If a governor's got a question, they answer it. They get somebody assigned to it from an action standpoint. He's calling people back personally. So he's been impressive, and I just say we're grateful. I think every governor in the nation is grateful that we have a former governor as vice president, just as Senator Hoeven's a former governor. Having former governors in these roles, they really help understand what we need. But as we also know, and as I know the vice president and his team, including Dr. Fauci and Dr. Birx, understand that the curves are different for each state. And I think, well, that could be a generalization for the whole nation. North Dakota, we were late to the game in terms of the coronavirus coming here later, and we're trying to be first to reopen. That would be an ideal situation if we can do that. But I understand why he might say that based on looking at data for the whole country. But we've got to, regardless of what any official says, we've got to look at the data for North Dakota and make decisions here based on our situation. And Scott, I can't believe you don't have a question for Senator Hoeven, but anyway, thank you for the question. Okay, who's next? Dave?
Going back to the 1.25 billion, you've got some money going to unemployment insurance. Potentially. What kind of things can you spend it on, and what can't you spend it on?
Well, they've outlined very clearly what you can spend it on, and I'm sure there'll be tests on the limits, again, when states are submitting their expenses to the federal, but some of the public health expenses, including, communication and enforcement of health orders, acquisition, distribution of medical and PPE, like the stuff that's gone into our cash or that we've already provided out, disinfection of public areas, technical assistance to local authorities, and then again, facilitating compliance with public health, facilitation of distance learning, improvement of telework. We've talked about the computer and phone systems would be eligible. Maintaining all of our state correctional facilities and county jails in a safe way, whether that's including improving upgrading the disinfecting sanitation, improving social distancing measures, care for the vulnerable population, including homeless and domestic violence, which we've talked about previously. We've announced those programs, anticipating that they would be covered by this, and they are. And so again, we're very pleased with with how this is listed, and of course, medical expenses, COVID-19 related expenses also fits into this as well. And again, as you heard from Senator Hoeven, advocating strongly. I mean, I think between the CARES Act, there's $100 billion for hospital. In the new legislation this week, I believe there's another $70 billion for hospitals. And so we know that hospitals have seen a big demand shock in terms of a drop in demand for their services, but the federal government has stepped up in a huge way to help support them. So we're very pleased. But the biggie, among other things, was the language that Senator Hoeven fought for that helped us make sure that we could spend it, because a week ago, unemployment insurance wasn't in there, and as you heard from me, that could be our single largest expense, and it was not included. So that's a huge thing that we're able to consider using that for shoring up our unemployment insurance trust. I'm sure that's a relief to all of our legislators when they heard that. So thanks on behalf of all the legislators too. Because it would have competed. I mean, we would have had to refill it if we didn't have a way. It would have been competing for dollars, from everything else we spend in state government. So that announcement last night took a lot of pressure off of the remaining biennium budget and also the 21-23 budget.
On the weeds, going back to the MMIS replacement, which was tens of millions of dollars, how much is it going to replace the mainframe at Job Service?
That hasn't been scaled yet, but a lot of the, when you move off an aging mainframe like that, likely we wouldn't even be buying a piece of equipment. We probably would just be buying, we'd have software that would run in the cloud, and we'd be buying services, cloud-based services, and you'd have, more security, more flexibility at lower cost. I mean, some of these IT replacements, cost of IT is actually going down as security and power is going up, and so that's the good thing. We just need the flexibility to go ahead and do that. Going to go Lane and then online.
Governor, with states like Georgia opening up soon, do you feel like people might become impatient and start to disregard CDC guidelines?
We've talked about this from the beginning. I think that we've really focused on individual responsibility in North Dakota, but even if you focus on individual responsibility, particularly as the weather is getting nice in North Dakota, there's what I'll call compliance fatigue that will set in. And then particularly, I think people are correlating the fact that we've had relatively low numbers where they might conclude that because of our low numbers, look, we didn't have to do any of this in the first place. That would be the wrong conclusion. I mean, North Dakota's benefited from the rest of the nation shutting down, and we've benefited from everything else that we're doing here. And that's one of the reasons we've got low numbers and low deaths and low case counts. So, I mean, there's one conclusion that you can have. You can stop a global pandemic with physical distancing because you do not literally give the virus a chance to jump from human to human. And so the number of transmissible contacts went down, the number of cases went down, that absolutely worked. As other states look to open up, we knew this because we knew that other states could be on the way down when we were on the way up. We've been trending up the last week when other states are trending down. So it's going to be a challenging communications issue. It's going to be a challenging discipline for the people in North Dakota, but we have to remember why we got in this, and that was to try to protect those that were most vulnerable. And I think we're on a good path, but regardless of what other states do, we have to make decisions that work for the citizens of North Dakota. So we could monitor and learn from other states. If other states, get wide open and have a resurgence or a flare-up or a community outbreak, that will help us understand what we need to do here to make sure that doesn't happen here. I mean, we learned from nursing home outbreaks in Washington and New Jersey that where it's gone up other places with multiple deaths. 35 in Washington in one facility, 70 in one in New Jersey. That's creating a lot of urgency here for us to make sure that we continue to fight hard to protect those people.
Senator.
Yes, a question for Senator Hoeven. He's busy working over there on his phone. He's cutting a deal. He's texting McConnell or something over there on his phone.
Thomas Simon, Williston Trending Topics. The
Talked to him for an hour this morning. I don't need to talk to him again today. I'm sorry.
The president has a pretty big bully pulpit. How do you see your role as a blocker for Governor Burgum so he can focus on making the best decisions for North Dakota without pressure from the White House?
First off, I think Governor Burgum works very closely with the administration. They have regular conference calls with the president, with the vice president, with the task force, with cabinet officials. You can ask him, but I think he's got a very good working relationship with the administration. I think in terms of my role, you saw that here today. The state of North Dakota, we worked in the CARES Act, $1.25 billion for the coronavirus relief fund. That's great, but it's got to come in a way that the state of North Dakota can use it. And so this was a key change in terms of empowering the state, and not just North Dakota, but all the states, to be able to use that money as effectively as possible. Remember, that $150 billion fund, that's just one fund, as the governor said. Then you've got $100 billion for the hospital fund, which we just added $75 billion to, okay? But again, it's got to come in a way where the states can use it, and the states are going to have very different needs. So for that coronavirus relief fund, New York may need to use it in a certain way because they have so many cases of coronavirus. Out here, it's going to be different. But we have real impacts to our businesses and our workers that we've got to address, and now we're going to be able to do that, whereas before we couldn't. In other words, we could have gotten that $1.25 billion and not been able to use it when you have very big needs in North Dakota. Well, that doesn't work, does it? So that's why it's so important that working with the governor, working with the administration, working with my colleagues in the Senate and the House, with Senator Kramer and Congressman Armstrong, we're able to make sure that these programs can be used in a way that's effective for North Dakota. Thanks for the question.
Jacob and then Dave.
Governor, when you're hoping to open up the economy on Friday, wondering if you have any concerns about employees suing their employers over catching coronavirus when returning to the workplace.
Well, I want to rephrase your statement because we haven't given a date. We did extend our executive orders through April 30th, and we've given our 8 criteria, but we've not given any guidance about any reopenings on Friday, so I want to make sure we're clear on that. We're following the data, not the calendar. But I think that there, again, as we said, if there are people that are concerned about their work conditions, the first place to talk to is your employer. Employers in any environment want to make sure they take care of their employers. I talked to a set of employers last night on a call, and hearing great examples of what people are doing to protect their team members. And we've got North Dakota employers that that are based in North Dakota that operate in multiple states under lots of different jurisdictions, some of them with thousands of employees, and they've had 0 coronavirus cases. And so we know that there's success models to pattern after, and that's part of what we're going to be focusing on the North Dakota Smart Restart. But I think you will hear concerns from some employees, from some employers. And again, we would encourage them, your first stop, talk to your employer, because we know that employers care about their workforce. And if they don't, then again, OSHA, occupational safe and health and safety standards is another place to touch base with if you've got a real complaint. But that some of those the state's not going to get between some of those, and that'll be between the employee and the employer, just like it might have been without the pandemic. There's always people that may feel that their work environment isn't as safe as it should be, and they've got First Avenue, talk to your employers. And in our country, thankfully, there's lots of safeguards for employees to get their concerns resolved. And if they think it's an issue of discrimination related to it, of course, then you can call our own Secretary of Labor here, our Labor Commissioner. But if it's related to workplace health or safety, OSHA should be the contact. Dave, and then online.
Okay. Just quickly, Governor Walz in Minnesota basically said schools are shut down for the remainder of the school year. And I know you've been kind of leaning maybe toward that direction because everything's online, things are going well. Does any reaction to what the governor did in Minnesota?
No, no reaction, and I wouldn't even, I wouldn't hate to characterize what I've done as leaning one direction or other. We've tried to be not shading one way or the other. We've talked a lot about seniors and trying to rescue some of the senior year. I know that Montana is looking at getting some, or at least giving school districts the option that maybe some of their rural school districts might get back in their building sometime in May. So we've got neighbors that are approaching it different ways. We'll continue to look at what all our neighbors are doing, but we got to make decisions here based on our own data. And since you did bring up Minnesota, there was one other thing. We have had a lot of questions around travel to lake cottages, which is another thing, which is only fits a segment of people, but I wanted to be clear about that. The question was, if they went over to their cottage, came back to North Dakota, did you have to quarantine for 14 days? And so I want to be clear, there was a misquote earlier that somehow I was encouraging people to go to their cottages. That would be inconsistent with me every day saying that follow the North Dakota SMART, which includes no non-essential travel. So there was never any encouragement, but I have been on radio programs or here talking about two words, common sense. And common sense would apply that if someone were to travel to their own property across a border in another state, whether it's to get food out of a freezer that's rotting, or check mouse traps, or take some shutters off on a Sunday afternoon, or rake their lawn. If they're doing that and maintaining physical distance and then coming back to North Dakota and they've not bought gas, haven't been to a grocery store, haven't been to a 4th of July party with 500 people, if you haven't done any of that here in April, when the ice is still on the lake in Minnesota, if you do that and see no one and come back, you do not have to quarantine. Okay, I mean, that's just common sense, because you could be, you could be at one of our big box retailers and have more contact with people, during a shopping outing than you could going to your cabin and back. So again, I just want to make sure that we've got common sense. And again, as it relates to this shared communities we have on the Minnesota border, and making that work, common sense. On Monday, I had our DOT check. We had 49,000 vehicles cross the I-94 bridge between Fargo and Moorhead. I mean, let me assure people, there's no mechanism to know whether a car coming across that bridge was at a solo trip for a few hours to check on their lake cottage to make sure it made through the winter, or whether they were returning from Walgreens in Moorhead where they had a prescription filled, or whether there's someone who lives in Moorhead and works in Fargo, either in a manufacturing setting, a nurse, or something else. And so these are communities that are integrated across those two communities, and we've got in a day, we got 49,000 crossings there. I don't think we got 49,000 people that might have made solo trips to check on their lake cottages. So let's, again, focus on proportionality. Let's use common sense. And let's, as neighbors, the good neighbors we've always been with Minnesota, will continue to be good neighbors. And I want to be clear to Governor Walz, I'm not encouraging people to go to their lake cottages, but we are certainly saying that if you've made that trip and you've done it smartly and not had contact, you do not need to quarantine when you come back to North Dakota. Thank you for being North Dakota smart, even when you're visiting your Minnesota property. Okay, Jacob.
Final question from the Senator.
Yay. And I think it's just, this is the last one more question to the Senator, and then we'll wrap up after that.
Senator, you noted that there would be support for another PPP after this. Wondering if there's a certain number that's supposed to be aimed for, or if there's another hitch in this rollout like the one in the first one that you might be expecting.
Again, I think we have to assess it as we go, right? That's just the intelligent way to do it. And, we've been talking about the business programs today, or I've talked a lot about the UI program, unemployment insurance, the help for small business PPP. So what I would say to you is, I think there will be more based on the need and the effectiveness of the program, and that's something we need to keep assessing as we go forward. But we need to do that, and I'm glad you asked that question, because we need to do that in other programs too. For example, in this bill, the supplemental to the CARES Act, we've added $75 billion. We know there's a need out there for rural hospitals, and not just hospitals, but other healthcare providers too. Nursing homes, look at where that vulnerable population is. So just like working with Governor Burgum and his team, we make changes in the coronavirus relief fund, in the hospital, in the funds that come out to the hospitals, the healthcare centers, the nursing homes, the work we do with our farmers, the energy industry. All of these programs are going to take a lot of work to make them effective. So we have to assess what's working, what's not working, recognize it's going to be different in different parts of the country, give flexibility to the great leaders that we have and the governors around the country and other local leadership. Our mayors are doing a phenomenal job, legislators. Empower them to do what works for their citizens. The best government is the government closest to the people. So this is going to be an ongoing process, and I think your question contemplates that. Let's do this in the most intelligent, effective, and cost-effective way possible. And again, Gov, thank you. Appreciate it very much.
Thank you, Senator Hoeven, and thank you, North Dakota, for tuning in. Thank you, media that was here and online. And again, we'll look forward to seeing you tomorrow at 3:30. Stay healthy, North Dakota.